In the name of Allah, the most gracious and the most merciful. Here I am discussing the axillary artery. It is the continuation of the third part of the subclavian artery, as I have shown you with the pencil. The axillary artery commences at the outer border of the first rib and enters the apex of the axilla by passing over the first digitation of the serratus interior behind the midpoint of the clavicle. Behind the midpoint of this clavicle. The first part of the axillary artery and the cords of the brachial plexus are enclosed within the axillary sheath. This and this is enclosed in the axillary sheath, artery and the brachial plexus. Remember, not the axillary vein. Axillary artery is divided into three parts. First part is above the pectoralis minor muscle. Second part is behind this pectoralis minor muscle, and the third part is below the pectoralis minor muscle. At the lower border of the teres major, it becomes the brachial artery. Relationship of the artery to the brachial plexus. The lateral and the posterior cords lie superlateral to the first part of the axillary artery, whereas the medial cord lies posterior to the artery. Related to the second part of the artery, the three cords of the plexus lies in the same position as their names indicate. The third part of the artery has the branches from the cords of the brachial plexus, having the same relation to the artery as their parent cord. The medial root of the median nerve crosses in front of the artery to join the lateral root and form the nerve that lies lateral to the artery. This crosses the front of the artery, the medial root of the median nerve, and it forms the nerve which is lateral to this artery. Relation of axillary artery to axillary vein. The axillary vein lies anteromedial to all the parts of the axillary artery. Surgical approach to the axillary artery. The first part of the artery is deep. We can approach it by splitting the clavicular part or clavicular head of the pectoralis major muscle and piercing the clavipectoral fascia. The rest part of the axillary artery is superficial, and we can approach it through the floor of the axilla in the groove between the coracobrachialis muscle and the long head of the tricep muscle. Branches of the axillary artery. The first part of the axillary artery gives off one branch, superior thoracic artery. It is shown by pink tag. It is the small artery. It runs forward and supplies both the pectoral muscles. The second part of the axillary artery gives off two branches, thoracoacromial branch and the lateral thoracic branch, shown by the yellow tags. The thoracoacromial artery, it skirts the upper border of the pectoralis minor muscle and pierces the clavipectoral fascia and divides into four branches named deltoid, clavicular, pectoral, and acromial, radiating at right angles from each other in the direction of their names. The lateral thoracic artery, it follows the lower border of the pectoralis minor muscle and gives branches to this pectoralis minor and the serratus inferior muscle, and it is very important contributor of blood to the breast. Lateral thoracic artery. In the female, it is important contributor of blood to the breast. The third part of axillary artery has three branches: the anterior circumflex humeral branch, the posterior circumflex humeral branch, and the subscapular branch, which is the largest of all the branches. The anterior circumflex humeral branch, it runs deep to the craccobrachialis and both the heads of the biceps. Here it gives off an ascending branch which runs up the intertuberculous sulcus to the long head of the bicep and the capsule of the shoulder joint, thus supplying them. The anterior circumflex humeral branch passes round the neck, surgical neck of the humerus and anastomose with the posterior circumflex humeral branch. The posterior circumflex humeral branch, it passes through the quadrangular space along with the axillary nerve above it. It then supplies the deltoid, the lateral and the long head of the triceps and the shoulder joint. It ends by anastomosing with the anterior circumflex humeral artery and profunda brachii artery. The subscapular artery, it runs down to the posterior wall of the axilla and gives off the dorsal branch known as circumflex scapular artery. The circumflex scapular artery, it passes through the upper intermuscular triangular space between subscapularis, teres major, and medial to the long head of the triceps. It curves backwards round the lateral scapular border. Distal to the circumflex scapular artery, the subscapular artery changes its name to the thoracodorsal artery. It runs along with the nerve of the same name into the latissimus dorsi and supply the latissimus dorsi muscle as well as serratus inferior muscle.